Question number 1. What is a pulse oximeter? Question number 2. How pulse oximeter working mechanism? What is a pulse oximeter? A pulse oximeter is a painless test that measures your oxygen saturation level or the oxygen levels in your blood. It can rapidly detect even small changes in how efficiently oxygen is being carried to the extremities furthest from the heart, including the legs and the arms. The pulse oximeter is a small, clip-like device that attaches to a body part, like toes or an earlobe. It's most commonly put on a fingertip. Pulse oximeter provides two information on display. 1. Oxygen saturation. 2. Heart pulse rate. Before going to the oximeter mechanism, we need to understand what is oxygen saturation. We all know that blood carries oxygen from the heart to the rest of the body. Oxygen in blood is specifically carried by hemoglobin molecules. Hemoglobin with oxygen called oxygenated hemoglobin. Hemoglobin without oxygen called deoxygenated hemoglobin. Oxygen saturation simply refers to the percentage of the available hemoglobin that carries oxygen. A sample situation for your reference. 1. 10 hemoglobin units and 0 oxygen. So oxygen saturation is 0%. 2. 10 hemoglobin units and 5 oxygen. So oxygen saturation is 50%. 3. 10 hemoglobin units and 10 oxygen. So oxygen saturation is 100%. How pulse oximeter working mechanism? Oximeter operate based on this principle of different absorption and light emission of the oxygenated hemoglobin and the oxygenated hemoglobin configurations. The oximeter utilizes an electronic processor and a pair of small light-emitting diodes facing a photodiode through a translucent part of the patient's body, usually a fingertip or an earlobe. One LED is red, with wavelength of 660 nanometers, and the other is infrared with a wavelength of 940 nanometers. Absorption of light at these wavelengths differs significantly between blood loaded with oxygen and blood lacking oxygen. Oxygenated hemoglobin absorbs more infrared light and allows more red light to pass through. The oxygenated hemoglobin allows more infrared light to pass through and absorbs more red light. Oxygenated hemoglobin and the oxygenated hemoglobin absorption. The LEDs sequence through their cycle of one on, then the other, then both off about 30 times per second. The amount of light that is transmitted is measured. These signals fluctuate in time because the amount of arterial blood that is present increases with each heartbeat. By subtracting the minimum transmitted light from the peak transmitted light in each wavelength, the effects of other tissues is corrected for allowing for measurement of only the arterial blood. The ratio of the red light measurement to the infrared light measurement is then calculated by the processor in the oximeter. This ratio is then converted to oxygen saturation percentage by the processor and displaying on the oximeter screen. Oxygen saturation level between 95 and 100%, HELT. Oxygen saturation level between 94 and 90%, visit a doctor to seek advice. Oxygen saturation level below 90%, go to emergency room to seek urgent medical attention. Thanks for watching.